Are you retired and turning 65 soon? This video from the Wisconsin Department of Employee Trust Funds, or ETF, will help prepare you for the transition to Medicare. Most of the information provided in this video applies to state, University of Wisconsin, and local retirees. Where there are differences for local retirees, we'll point them out. Meet George. He's been retired from state service for 2 years and has continued his health coverage through ETF. With his 65th birthday coming up, he has some questions about Medicare. George wants to know, there are so many parts to Medicare. What do they all do? What steps do I need to take before I turn 65 or once I'm enrolled in Medicare? How does Medicare interact with my ETF benefits? Will my monthly costs change? When I enroll, how will it affect my wife? She's 61 and won't be eligible for Medicare for a few more years. First, let's take a look at the different parts of Medicare. Medicare Part A is your hospital care. It helps pay for inpatient hospital stays and a couple other things such as hospice care and skilled nursing facilities. Typically, once you turn 65, you are automatically enrolled in Part A. You likely don't have to pay for it in retirement because you already paid for it through payroll taxes when you worked. Medicare Part B is your doctor care. It helps pay for routine health care including medical visits, lab tests, and more. You have to pay for Part B once you enroll. We'll cover that in a moment. Now on to Medicare Part C, which is optional. You have Part C only if you're enrolled in a Medicare Advantage plan. These plans are a combination of Parts A and B and oftentimes have supplemental benefits. If you select a Medicare Advantage plan, you still have to pay for Part B separately. ETF offers a Medicare Advantage plan. You can learn more about it in the It's Your Choice section at etf.wi.gov or in the health benefits information available during the annual open enrollment period in the fall. Medicare Part D is your pharmacy benefit. It helps pay for prescription drugs you may need. Your health plan with ETF includes Part D, so you don't need to take any extra steps to enroll. Now that we've gone over Medicare Parts A through D, let's talk about how George can get ready for Medicare. A few months before George turns 65, he'll receive a letter from ETF asking for his Medicare information. He'll need to complete the action steps outlined in the letter for a seamless transition, including enrolling in Medicare Part B. Around the same time, he'll also receive information from Medicare and Social Security. If George hasn't received this information within a month of his 65th birthday, he should contact ETF or Medicare. His spouse will go through the same process prior to her 65th birthday. Most plan options coordinate with Medicare, meaning Medicare pays first and then the health plan pays second. When George begins Medicare coverage, he will see some changes. He'll start receiving statements from Medicare. He will pay less money out of pocket, if any at all, when he sees the doctor or uses other medical services. If he's enrolled in a high deductible plan, he will receive a letter from ETF notifying him that his plan has been switched to a non-high deductible plan. His monthly premium, or the amount he pays each month for ETF's health insurance, will decrease. However, he will have to pay for Medicare Part B separately. If George is receiving Social Security, his Medicare Part B premium will be deducted from those payments each month once he enrolls. If he delays receiving Social Security, he'll need to pay Medicare directly each month for Part B. George can see how much his monthly premium will change by going to the It's Your Choice section at etf.wi.gov and selecting the Rates tab. Lastly, if George is covered by ETF's life insurance plan, he will no longer have to pay these monthly premiums. Even though George will experience some changes, other parts of his health insurance will remain the same once he's 65. His prescription drug coverage will not change, and neither will his spouse's coverage. Since George is a state retiree, his spouse will still have the same benefits package until she becomes eligible for Medicare. This would also be true if George had other dependents covered by his plan, such as an adult child. If he were retired from a local employer, such as a city, his spouse would most likely have the same benefits package. However, local employers can change which options are available for retirees. As you can see, George has a few steps he needs to take to ensure a smooth transition to Medicare. If he has any questions, he can contact ETF or Medicare for more information. To learn more, check out our health benefits videos in our retirement and Medicare series. And don't forget to stay connected with us for important and timely benefits information.